Welcome back to Smitty's Learning Room. Today we're going to continue looking at the determinants of health and focus on the environmental determinants. So we'll start by having a look at where this comes from in the syllabus. Now, it's under the focus question, what influences the health of individuals? And previously we've had a look at other determinants of health, including the individual determinants, socio-cultural factors and socio-economic factors. And today we're going to have a look at this one here, the environmental factors. So for example, the geographical location, so where someone is actually located, within Australia, access to health services and also access to technology. Now remember, when you're taking notes from this video or all of the videos in this series, that you need to be able to come across this side of the syllabus and analyse how an individual's health can be determined by a range of factors acting in various combinations. So how might someone's environmental factors and their individual factors affect their health, or how can their health be determined by more than one of those determinants of health? So this is the final video in this series for the determinants of health. So if this is the first time you're watching a video on determinants of health, you'll need to go back and have a look at the individual determinants, the socio-cultural determinants, the socio-economic determinants, because this video will look at the environmental determinants. So as mentioned before, our environmental determinants, there's lots of different ones, but some of the main ones that we can have a look at here is geographical location. So whereabouts is an individual living, or where do they spend most of their time? Access to health services, so how readily available is health services to that individual? Can they walk down the street to the doctor, or do they have to drive a considerably long way? Do they have to, sort of catch an aeroplane or be airlifted to hospitals? Do they need to have access to remote hospital or doctor services? Those sorts of things we're going to be having a look at. And then having a look at the access to technology, and how has technology impacted on our health, and how does that have either a positive or a negative impact on the individual's health and the decisions they make about health. So we're going to start by looking at the geographical location, and how does an individual's geographical location impact their health? Now, when we think about health and we look at an individual's location, often we go straight away to people being isolated or people being in rural and remote areas. And so it's important to understand that an individual's geographical location, regardless of whether they're remote, can actually have an impact on their health. So people living in regional and city areas are exposed to health risks that people in rural and remote areas aren't exposed to, and vice versa. So when we look at rural and remote populations, a rural population has somewhere between 5,000 and 99,000 people living in that town or that area, and then a remote population has less than 5,000 people living in the area. And so sometimes a town or an area may actually not just include the town, but may include farms surrounding that town. And as you know, in remote areas or rural areas, those towns can be quite large. So often they might have, a shire, for example, rather than the town, because it's actually quite a large area that the population falls under. Now, when we look at these rural and remote populations, a lot of these rural and remote people are ATSI populations, because they obviously are in remote communities. And also we see that people living in rural and remote populations often have a lower socioeconomic status than those living in regional or city areas. And because of that, they've just got that decreased access to, to good health outcomes or access to healthcare. So when you look at something like the fact that rural and remote people have decreased health outcomes just because of their geographical location, if we add the fact that they're Aboriginal or Torres Strait Islander, or they've got a low socioeconomic status, on top of the fact that they live in a rural and remote community, that's where we can see two sort of determinants coming into play there, which is going to, have a greater impact on that individual's health, and therefore they're going to have more decreased outcomes or more negative outcomes in relation to their health than if they were a non-ATSI population person, or if they were of a higher socioeconomic status living in those areas. So you can see here that when you stack up different determinants, it can actually further decrease the health outcomes of an individual. So when we look at people who live in these rural and remote areas, they've got an increased mortality rate, so that's increased death rates in those rural and remote areas, and that's for lots of different reasons. Decreased access to healthcare and facilities, decreased access to health information, lower socioeconomic status, the fact that a lot of those populations are Aboriginal and Torres Strait Islanders, but mainly because there's an increased level of risk. So, often people who live in rural and remote areas have to drive long ways to get to certain places. So obviously every time you get in a car, that risk is increased. Just the type of work that people generally do in these areas is generally manual labour or, sort of heavy labour and working with big machinery. And so this could also increase that level of risk that the individuals are exposed to. Now, when we look at city populations or regional populations, they're exposed to increased air pollution, increased traffic congestion, and increased noise pollution. So even though they're not geographically remote and disadvantaged because they don't necessarily have, because they have better access to things, they actually then, as a result of having an increased access to things and being more built up and having, a bigger population, they then obviously are faced with these sorts of issues of air pollution, traffic congestion, and noise pollution. Now, when we look at the cities and we look at, why are people who live in regional areas or people who live in cities better off in relation to their health, generally because this concept of the built environment, it's more significant in the cities. And so if we've got an increased built environment, we're obviously going to have an increase in health outcomes. So when we talk about the built environment, that's things like buildings and facilities, infrastructure, parks and, cycle pathways and those sorts of things, safe roads. And so if we look at this built environment, generally in regional areas and the city areas is a lot better than those rural and remote areas. So therefore they're going to have increased access to services and facilities, including health services and facilities, but also leisure and recreation services and facilities, and decreased risks when they use things like the roads, because they're obviously of better quality than those that are in remote areas. And then one other thing that is generally higher in the cities and regional areas is this concept of fluoride tap water. So fluoride tap water has been identified to have far better benefits for people than drinking just straight water. And so with the generally people living in city and regional areas, their water is treated before they get to consume it and treated with fluoride. And so obviously that then has links to better health outcomes. So people living in rural and remote areas, it's not necessarily always the case that their water has been treated with fluoride. So next we look at the access to health services. So generally speaking, with isolation, so those populations in rural and remote areas, there's a decreased access to health services. Because of this, there's an increased need for first aid, so people providing first aid to themselves or to people near to them. And there's also an increase for phone health care. So often because of their isolation, they may choose to ring through to a doctor, where the doctor will or the ambulance will provide them with the necessary steps that they need to take to look after that person while they're waiting for health services to arrive. A huge thing that sort of comes into play in relation to rural and remote populations or isolated populations is the Royal Flying Doctor Service. So this is essentially providing healthcare services in lots of different forms. So from remote clinics to education to actually having doctors fly in and fly out on regular occasions, or if somebody actually has a serious incident, that Royal Flying Doctor Service can locate them and transport them to the closest hospital. Now, when we look at health services in cities or in regional areas, because of the sheer density of the population that is much higher, there's an increase in population compared to rural and remote areas, there's generally a much longer or an increased rate for public health care. So that's things like doctors, public hospitals. And then because of that, there's a decreased availability of hospital beds in public hospitals. And this is often why you see people in cities or in regional areas taking up options of private health insurance, because that allows them to have increased access to other health facilities and services, because there's often this delay for public health care because of the sheer density of the population in those city areas. Finally, we'll have a look at the access to technology and how has this impacted health. And obviously, we can see that there's been an increased availability of technology in the last 10 years. And that can just be general technology from, TVs to music, to sorts of different types of media, to phones, computers, iPads, that sort of thing. But then also much more advanced technology, like technology that's used to, to screen for health conditions or diseases or illnesses, or machines which actually, assist in the delivery of medicine, so like radiotherapy machines, those sorts of things. And so obviously we've got such a huge impact that technology has had, but has this been a positive or a negative impact on individuals' health? So when we look at these negative concepts here, the introduction of, portable devices or smart devices has had a decrease in health outcomes due to inactivity. So, 20 years ago, young people didn't have access to or they may have had a video game, but didn't really have access to these smart devices, and so spent a lot of time being physically active in their spare time rather than being inactive or sedentary, engaging with technology. And so obviously when you think about that, today's youth compared to say 20 years ago are going to have health issues that are related to inactivity. So things like obesity and diabetes, because they're not being as physically active as past generations. There's also an increased cost of emerging technologies. So if you think about the concept of every time a new iPhone comes out, they seem to get more and more expensive. And so if you think about populations living in rural and remote areas who are also, fitting in that category of a low socioeconomic status, that they can't necessarily afford the new and emerging technologies, and so therefore are using older technologies, which sometimes, in some cases, may not be sufficient for what they need to be. Now, another aspect for rural and remote populations is that the concept of the decreased access to technological support for these populations. And so, not only are they not necessarily being able to access the latest and greatest technology, they're not able to access, help desks or, Apple help to try and sort of get these devices fixed. And so therefore, often these devices may become obsolete or the individual is using them incorrectly. Now, when we think about that sort of thing, if they're not accessing, the internet, or they're not accessing health services online because their device isn't working, that's obviously going to contribute to decreased health outcomes or health literacy for that individual. When we look on the positive side of, this increase of available technology, it's obviously giving us an increased access to health services and information. And if we go back to those individual determinants about, health knowledge and health literacy, it's really important that an individual empowers themselves to, be educated and also to seek further information in regards to their health. And so having the internet, and instant access to things like Google to find out things in relation to our health, has obviously increased our access in relation to those health services and information. Now, in line with that, because we've got an increased mobile phone and internet coverage, this means that more people can access these health information services more of the time and access health services online more frequently, rather than having to maybe perhaps wait to see a doctor, or maybe they don't even have access to those sorts of services in the community that they're living in. If we look at the concept of the increase of mobile phone coverage, that's obviously really important for rural and remote populations so that they can actually get in touch with health services such as the Royal Flying Doctor Service. So prior to mobile phone coverage or the concept of the 5G network, a lot of really remote populations may not have even been able to have mobile phone coverage. Farmers may, if they had an injury out on the farm, may not have been able to, call in 000 from the farm. They would have to somehow work out how to get back to the house and use the landline. So that's where that concept of the increased mobile coverage is really important in relation to accessing, first aid and immediate emergency health care. Now, with the introduction of things like self-help websites, sort of like reachout.com, Beyond Blue, these sorts of things. So often we have a lot of mental health services which are available online for people to use, but also the children's helpline. So that's that free phone service available for children to call, which is essentially a counselling service. So with the introduction of these, sort of non-for-profit organisations who are giving available health resources online and via the phone, this is increasing access to health and trying to increase positive health outcomes for individuals who may be isolated or may have decreased access to services where they are. And so when you look at this concept of the technology, there are so many things that we can talk about in relation to how it's improved health outcomes. But you just need to understand that it's not just the positive things, there's also negative things that relate to the access to technology and health. So just wrapping up this concept of the determinants of health, remembering that there are 4 determinants. So the individual, the socio-cultural, socioeconomic and environmental determinants. Now each of these determinants have their own sort of little subcategories underneath, and it's really important that you understand which factors come under each of these, because you will need to be able to talk about how these determinants interact and how they can affect an individual's health. And not only are the determinants of health in the preliminary course, they're also in the HSC PDHPE course. So something that you really need to get your head around are these determinants of health.